Hello everyone, welcome to sqadia.com. Today we are going to talk about surgical infection. Surgical infection is a surgeon's worst nightmare. A surgeon has performed a flawless surgery, or a surgeon has come across a patient with a gaping wound. That wound is infested, or that post-operative patient develops a surgical site infection. That speaks to the methods that are being used in the ICU. That speaks to the contamination in the operating room itself. That speaks to contamination by the surgeon even. So it's the worst nightmare, and it's difficult to manage because the body is already in a state of crisis. Being in a state of crisis, it's very difficult to manage that surgical infection. So let's see what this lecture holds, and let's talk about surgical infection in a little detail. The lecture has been divided into 5 sections. In the first section, we'll talk about the history of surgical site infections. We'll see since when these surgical infections were noticed and what is the history behind the development of the surgical techniques we know today. Then we'll talk about the microbiology, the microbes, the most common microbes which are involved in surgical site infections. In the second section, we'll talk about the sources and presentation of these surgical infections. We'll see what the sources of infection actually are. Then we'll talk about the decisive period and the reduced resistance in the human body. We'll see what the decisive period in itself actually is, and we'll check out the causes for the reduced resistance. Then we'll talk about the major and minor surgical site infections. We'll see the difference between the two and how to manage them. In the third section, we'll talk about a localized infection, an infection that has not yet spread to the entirety of the body. We'll grade and score the wound according to various grading and scoring systems. We'll talk about an abscess. We'll see what an abscess actually is and how do we identify an abscess and manage it. And then we'll talk about cellulitis and lymphangitis. We'll see what these terms mean and how to manage them. In the fourth section, we'll be talking about specific local wound infections. Now we're moving on to a specific domain of infections. These infections would include the gas gangrene, the tetanus, and the synergistic spreading gangrene, which is also known as the necrotizing fasciitis. This is a special category of infections. This section is very important because it's the you can say the hell section, the most difficult to manage section, the worst of the worst section. Finally, in the last section, we'll talk about the systemic and viral infections. We'll see how the sources of infection might spread throughout the body and lead to bacteremia, and we'll see what systemic inflammatory response syndrome is. Then we'll talk about how hepatitis in HIV patient might affect the surgeon himself, and then we'll talk about the precautions that must be taken by the surgeon and after contamination. So this is the crux of this lecture. In this lecture, we'll see a lot of clinical things. So I'll keep my mind sharp. I'll try to memorize and learn whatever is there in this lecture, so that might help me in my clinical practice. So I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.